Over here at DCSmokeFree, we're wrapping up season 1 of our podcast, Everyday Epidemics. This was the podcast where we brought on experts and doctors from across the country to talk about all things public health.
Launch initiated.
Whoa, that was a bumpy ride. Mitchell here from 36 Hours into the Future. Sorry, I was aiding in the battle of nicotine addiction from across the county. Did I just interrupt myself introing our final podcast episode? Well, past me will never know. Anyway, here are a couple of moments from each episode of the podcast from the very first season. In episode 1, we interviewed Dr. Bob Dannenhofer. He is a pediatrician, local here in Douglas County, and been doing it for a long time. We had a great conversation about the trends he is seeing and talking about youth vaping in general.
Is vaping safe, or is it safer than cigarettes? I have a hard time answering that question for a couple of reasons, but I kind of want to get your take on it and how you might approach that when you get asked that question.
Well, cigarettes, we know, are very unsafe, and they're unsafe for several reasons. The first is you're breathing in burning material, and those burning materials have microparticles that get into the lungs and cause irritation in the lungs and lead to COPD and to lung cancer.
Right.
Also, when you're breathing in carbon monoxide, and it's not good to be breathing in carbon monoxide. We know even low levels of carbon monoxide for a long period of time have detrimental effects. And then lastly, you're breathing in some nicotine, and nicotine is a very potent chemical and has some effects, some which people like, which is the relaxation they get from it, but some which are harmful, such as the vasoconstricting effects of nicotine. Now, with vaping, what you're doing is breathing in an aerosol. That aerosol contains multiple chemicals and some nicotine. Now, it doesn't have any burning material, so that's good. And it doesn't have carbon monoxide, and that's good. But it does have other chemicals which can be dangerous. You may remember a time back in the 2019 where we had a lot of people being injured from vaping-associated lung injury.
Right. Valley, yep.
Or Valley is what we used to call it. And that was from things that were added to vapes. Now, there's a lot of other things added to vapes too, and we do not know what the long-term effects are, so we do worry about that. And the concern with vapes is that kids who are vaping are getting far more nicotine than they ever got through smoking.
Right.
So it used to be kids would smoke and they'd smoke 1 or 2 cigarettes a day. We're now seeing kids using a full vape cartridge every day.
Right.
So they're getting dozens of times as much nicotine as kids ever got from smoking.
This is episode 2, where I interviewed the former FDA director for the Center of Tobacco Products, Dr. Brian King. And we discussed his new task force that promised to curb the distribution and sale of illegal e-cigarettes. So it's also my understanding that nicotine pouches, things like Zyn, Ono, other brands, aren't regulated at this point in time. Is that true?
No, that is incorrect. They are regulated. So FDA has authority over these products. We've actually issued several compliance actions, including for Zyn several months ago, including for underage sales and also for unauthorized products as well. So we do have the authority over these products. We do regulate them. I think one area where the misperception might be that as a part of U.S. regulation, companies with new tobacco products have to submit an application to the FDA, and we are required to review that. And we determine if they can be authorized for marketing in the United States. That said, when we ultimately implemented this authority, we were deluged with over 26 million applications for e-cigarettes alone. And so we're still working to get to a point where it is a pre-market paradigm. That said, we're in that juncture. I'm hopeful we'll get to a point where we are through all those applications and we then review them within 180 days, which is what Congress initially intended. That said, we do have some products currently on the market that are not authorized. And so an example of several nicotine pouches, we have not authorized those products specifically, but they may be being sold. That said, there's no safe harbor for these products, and they're subject to enforcement action, which is what we've done, including for underage sales, as well as for illicit sales for recent nicotine product pouches within the past couple months.
In this eye-opening episode, Dr. Stan Glantz, a researcher and leading public health expert, as well as a tobacco industry whistleblower, revealed the shocking truth behind the youth vaping epidemic.
When people talk about smoking and secondhand smoke, the disease most people think of is cancer. And smoking and secondhand smoke cause cancer, and cancer is definitely a bad thing, but the risks evolve relatively slowly. And in fact, cardiovascular disease, kills as many smokers as cancer. I think it may even kill more of them. And, and those effects occur quickly. And so I think it's really important that people who are interested in looking at the health effects of tobacco use really seriously look at cardiovascular disease as well as the other diseases that smoking causes.
A very special thanks to Dr. Robert Jackler for joining us on episode 4 of Everyday Epidemics podcast. Be sure to check out his work on Strida and his other upcoming research.
How has things sort of changed from what and what happened in the 50s and 60s versus what's happening today?
Important changes, but fundamentally, they're doing the same damn thing. They are targeting young people. Why? Because how many 40-year-olds wake up in the morning and say, hey, I think I'll start smoking today? Almost all tobacco use, almost all nicotine addiction begins as part of adolescent rebellion from about 11 or 12 to about 18 or 19. Not many adults pick up the smoking habit, and the industry knows this. And so they have to make smoking cool. They have to make that teenager who is standing on the sidewalk like this after school not cool, but a dumb chump who bought the big lie, right? That's the key thing we as public health advocates need to help educate young people about. But the industry is a wolf in sheep's clothing.
In episode 5, I sat down with my colleague Kendra Murray as we explored her role between doctors and public health and her role as a public health detailer. We talked about the power of motivational interviewing and the impact of her work on the community health in Douglas County.
In the grand scheme of things, in the 20th century, that time period, our lifespans increased by 30 years.
Wow, 30 years.
30 years. That's a lot.
It is a lot.
Our general lifespans. And so 25 of those years are more due to public health measures, and only about 5 of those are for medical advancements. But when you say public health, that's sanitation, that's nutrition, even job safety, not just like safety belts in cars and stuff, but job safety. All those things were a big part of that. 25 years of that chunk was, just thinking about things, making things safer and more sanitary for people.
Yeah.
In this conversation, I sat down with Dr. Katie Putnam and Ann as they discussed the transformative impact of OHSU's lung cancer screening program. Learn about the screening processes, who qualifies, and how early detection is saving lives.
But if you think about vaping, right, we're seeing lots more people who are using this more and more daily. It's much more accessible. They're taking hits all of the time. So they're, maybe, the thing is they're a little bit safer than cigarettes, right? That's the idea. That's how they're marketed. But the quantity is way higher. And so I imagine that as we get more studies and more info, we might continue to find these things are worse and worse and worse for us.
I wouldn't be surprised either, but you're right. It's that, because we talk so much in pack years, it's hard to be like, well, tell me about how much you're vaping. What do your cartridges look like? How often are you actually using it? We don't ask that well because we're still learning too in the healthcare system. How do we actually quantify this? And I think that's a next step and opportunity for helping folks with tobacco cessation.
Social media isn't just about trends and viral moments. It's a powerful tool for shaping public health narratives and driving real change. In this episode, I sat down with Zach to talk about those, the intersection of social media, YouTube, and public health campaigns. We have new daily content. That doesn't mean it's the best content every single day, but we're getting something out there. And Zach talks about, learning. Every time we post a video, we're learning on what to do, what not to do, what does well. And so by being consistent, we get better at content creation. We get better at improving our public health message. And we just have this living body of work that's out there for more people to search, more people to view. It's this evergreen content where people can go back and watch it years later, or 10 years later. Somebody comes across a box of Zyn and goes, "What is this? I don't remember what this is," because maybe it's banned by then or whatever. But now they can look at our video and go, "Oh, this is what it is. This is from a relatable person who's authentic, who's respected in the community, and is giving the best knowledge he has available at the time." So I think it's really important to be consistent with your content, to understand this algorithm, as Zach said, it's your audience. We want to share it to your audience, and for us, that's primarily youth and getting our message out to them.
Yeah, especially when you are new and you're just starting out. If you're not making those videos and trying new things, if you're not putting yourself out there, you're never going to figure out who wants to watch your stuff. You have to be willing to look silly, or have a video that you poured your heart and your soul into just royally bomb, and you're so discouraged. But you leave that video, you're proud of that video, and who's not to say, a year down the road, that video doesn't start getting views. That's another reason of how consistency plays a key.
In this next clip, I speak with Cascadia Pharmacy Group about how they're empowering pharmacists to support community health through vaccines, nicotine replacement therapy, and more. With this new services of pharmacists being able to provide NRT and other types of services, how does that expanding the traditional role of a pharmacist, especially in this lens of public health?
Honestly, it's things that we've done for years. It's just we haven't kind of reeled it into a program where we get reimbursed for those services. I know in Washington we have 22. Is that right, Tara? 22 ailments and minor ailments and different services that we can offer in our collaborative practice agreements. I'm not sure exactly in Oregon how many we have, or if we're there yet, but we're expanding that rapidly. And I know Washington and Oregon are real proactive in that area to allow the patients to have access to, test to treat UTI, hypertension, cholesterol, diabetes. I think you mentioned, all the immunizations, all the travel immunizations, and vaccinations, cuts, bruises, bumps, bee stings, burns, sunburn, all those type of things. And I think, honestly, the pharmacists get more satisfaction out of that type of treatment and interaction than they do on I just put pills in the bottle and said, counsel you to take it twice a day type of situation. So there definitely is a fulfillment and a satisfaction in that pharmacist space to be able to provide, services that can make a difference in the patient's life immediately and have, greater outcomes.
In this next clip, I sat down with public health expert Vanessa Becker to talk about the challenges of navigating health information in today's complicated media landscape. Well, everything changes over time, even cancer. I mean, if 30 years ago, I was like, this is how you treat cancer. Well, that would be totally wrong today.
Yeah.
So it's of the time, that's how we did it. And that was the best ways that we knew how.
Right. And I think if we communicated that more, and that this is what we know today, and reminded people of that, I think we would get a little bit less of a backlash. One of the backlashes that I'm seeing a lot now is oh, that was the science. You told us that, we had to wear 2 masks during COVID, and, so why would we trust you now? And so, I think just understanding that it's important to have that humility and not speak in absolutes and say science does change.
Yeah.
Everything changes, like you said. I mean, how we treat things change, and that's not bad.
Right.
But we communicate what we know today, and there are some absolutes, like the sky is blue, but there are other places. I mean, technically it's not, but the way we see it, it's blue. But
right.
So I think tracking that and understanding that the human psyche and how people receive health information about themselves and about their family is also complicated.
In this special panel episode of Everyday Epidemics, we sit down with 3 incredible leaders who are shaping the future of prevention work right here in Douglas County. Right now, one of the most popular products among high schoolers and middle schoolers is a product called Zyn. There's also other brands, Velo, Rogue, On, just to name a few. And these are small nicotine pouches. So you might see these things and go, I don't know what this is. This looks harmless. So I really encourage you to reach out and say, what do these look like? Look up pictures. We talked about how vapes can come in all different sizes and things like highlighters. So just knowing that, this is what they look like, this is what they are, can help you see signs in your student as a parent.
Yeah, I definitely think the behavior change is like one of the key indicators. And again, it's hard with teens because, they're going through a lot and they often can have different behaviors. But the kind of withdrawing from their normal interests, maybe there's someone who's an athlete and now they're not interested in going to practice. Maybe they're like typically a really strong student, but their grades are slipping. Maybe they are someone who like typically is responsible with their money, but then all of a sudden they're asking you for a lot more money and you're not sure what they're doing with that money.
Yeah, that's a really good one.
Yeah, so it's not necessarily one thing that will help you identify it, but like if you start keeping track and you're noticing 2 or 3 things, that's a really good time to not accuse your child of doing something that's risky, but like have a conversation. Hey, I noticed that you're not really into going to soccer practice anymore. Want to tell me more about that? Or somehow opening up that dialogue.
Am I back at the end of the episode? I've got to stop crashing in. Anyway, be sure to stay tuned because season 2 is coming out in September with some surprise changes and including a new co-host. Until then, we'll catch you next time.